Hello, this is Dr. David Green with the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what is the best treatment for spinal stenosis? Well, initially let's just talk about exactly what is spinal stenosis. That is a narrowing of the spinal canal and subsequent pinching of nerve roots. And it's usually due to bony and soft tissue overgrowth from arthritis as a person ages. So usually it occurs in individuals over the age of 50, and it often occurs at multiple levels. Now, this is looking at a cross-section from the side. So you see the spinal cord coming down in the middle, and there's bony overgrowth at this level, and it's pinching the spinal cord, but more often than not, it's pinching it off to the sides, so you're hitting the nerve roots as they come off. So here's what it looks like from the top down. So you can see the disc material here, the spinal canal with the spinal cord in the middle, and that's normal, okay? When you get overgrowth of bones from bony areas around the joints here, you see how it comes into the middle, so bones, and then you get some hard disc squeezing out and solidifying there. That can pinch this area in the middle, and it can cause symptoms because of that. Now, what are the symptoms? Well, they're going to range. Typically, you get an aching pain in the buttock area and the legs on the affected side. It may be both sides if both sides are affected. You may have symptoms of sciatica. In unusual cases, it may progress to leg weakness. Okay, and it may be mistaken for a hip joint problem. Sometimes the patient thinks, oh wow, I have pain in my hip, when in actuality it's referred pain coming around from spinal stenosis. So typically it's position related. So if someone's, this picture is very indicative of spinal stenosis. If an older individual feels better, for instance, when they lean forward on a shopping cart at the grocery store, then a lot of times it's because that opens up the spine and gives the nerve roots more room. Whereas if they stand straight up, for instance, if they're walking downstairs, then it actually pinches on the nerve roots because it closes down the spinal canal. Now, the terms to think of are neurogenic claudication. Neuro means nerves, and that's when spinal stenosis is pinching on nerves, versus vascular claudication, and that's from peripheral artery disease. So when a person starts to walk, they might get cramping in their calves, and it sort of moves up the leg. That's more vascular claudication. They stop after a certain amount of time, the pain goes away. Neurogenic claudication is not like that. It's usually positional related, so it actually goes top down from the buttock down to the thighs. So that's more neurogenic. In reality, most people with spinal stenosis, they don't have any symptoms. It's just something that might be seen on MRI, but a lot of, over half of patients who have it don't even know it. So what are the treatment options for spinal stenosis? Well, this is an elective quality of life condition. It is not an absolute requirement for surgery. So initially you should start with over-the-counter nonsteroidal anti-inflammatories and Tylenol. Okay, take them according to manufacturer's recommended dosing, but we're talking about like, Advil, naproxen, things that are over-the-counter, acetaminophen products, and those can provide excellent pain relief. Prescription medications may include such things as Neurontin and Lyrica. There are studies, such as this one out of Spine a few years ago, showing that those can be very effective for the pain relief of spinal stenosis. Physical therapy can help, as well as spinal decompression therapy. For acute exacerbations of spinal stenosis pain, prescription pain medication may be indicated. Long-term pain medication is a bad idea because the risks outweigh the benefits, but for short term it's fine. And then one of the gold standards for spinal stenosis is epidural steroid injections. Those can provide over 75% good to excellent results and be very effective in the treatment of spinal stenosis. So one of the questions is whether or not to have surgery for spinal stenosis is a quality of life decision. The decision should only be made after considerable conservative treatments fail, such as what I just showed you on the previous slide, and it would be a lumbar laminectomy. It's not a risk-free proposition, but a procedure takes about an hour. It's oftentimes outpatient, or you stay one night in the hospital. So when you look at spine surgeries in general, it's a fairly low-risk proposition, But having said that, it is a quality of life decision. It's not something you have to have done. So the surgical procedure, like I mentioned, is a lumbar laminectomy. You have to have general anesthesia. It's about a 1 hour procedure. Usually you don't need a spinal fusion. If you're having a lot of back pain or one slipped vertebrae on another, then a fusion may be indicated. It's low risks. 50% do end up with some stiffness in the back postoperatively. And basically this is what's happening is the bones on the back of the spine are being removed to end up freeing up these spinal nerve roots that are being pinched. Okay. All right, and there is a small chance that these nerve roots that you free up can get scar tissue around them later on, and the pain can come back, and that's called post-laminectomy syndrome. So the bottom line with spinal stenosis is that surgery can be avoided over 90% of the time with considerable conservative treatment options. Okay, epidural injections have over a 75% good to excellent result for spinal stenosis. They can be repeated every few months. Whether or not to have surgery is a quality of life decision, and if you have a spinal fusion on top of the laminectomy procedure, it adds a whole level of complexity onto the procedure and increases the complication rates more than double. It may be indicated though, but you have to be careful that it's not just being added willy-nilly. Arizona Pain Specialists is the leading pain clinics in Arizona. The doctors are board certified, award-winning. They have pain management doctors, chiropractors, physical rehab providers, acupuncturists. There are 5 locations that accept over 50 insurance plans, including personal injury, workers' compensation, PPOs, self-pay, Medicare, and Medicaid. They provide medical and interventional pain management. Check out the website at preferredpaincenter.com. And there's one number scheduling at 602-507-6550. I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.